In this video, I'm going to go over the clinical presentations of cystic kidney disorders such as autosomal dominant polycystic kidney disease, which is seen in adults, autosomal recessive polycystic kidney disease, which is seen in infants, and then medullary cystic kidney disease, which is most commonly seen in elderly. So here we have an example of cyst in the kidney, and then we have the ureter shown right here. So the first condition is autosomal dominant polycystic kidney disease. 85% of the cases of this disorder are associated with mutations in chromosome 16, and then another 15% are associated with mutation on chromosome 4. These patients present with this cyst inside the kidneys, and there is possibility of cysts also in the liver and pancreas. Clinical presentations of autosomal dominant polycystic kidney disease include hematuria, and so this is due to the rupture of cysts, which causes blood in the urine, concentrating defects of the urine, so the kidney is no longer able to concentrate the urine, and it's not really known why patients with autosomal dominant polycystic kidney disease present with this symptom, but then because of their lack of the concentrating ability, they present with polyuria and polydipsia. So these patients urinate a lot and they drink a lot of water. These patients are at increased risk of development of the renal stones. And the reason for that is that the renal cysts are increasing the renal volume, and thus there is more chance of forming stones in increased space. These patients can also present flank pain from the stones or from cystic rupture as well as infection, and then liver enlargement is another reason that can cause pain in these patients. Next, these patients can present with hypertension. And the reason for hypertension is that since there is a cystic rupture and renal ischemia, there is an increased release of renin that can cause hypertension. And thus for the treatment, the best medications are angiotensin-converting enzyme inhibitors as well as angiotensin receptor blockers, which inhibit the production or the action of the renin. Other complications that can arise from hypertension include mitral valve prolapse, which presents with a mid-systolic click and a crescendo murmur. And then there is also increased risk of berry aneurysm from hypertension in these patients, which causes subarachnoid hemorrhage, and these patients complain of the worst headache of their lives. The next condition is autosomal recessive polycystic kidney disease, which is seen in infants, and these patients present with cystic dilation of the collecting ducts, as well as the congenital hepatic fibrosis that causes portal hypertension. Now, because of the renal failure that these patients develop, they present with the Potter's syndrome from oligohydramnios, and thus present with pulmonary hypoplasia as well as limb deformities. And thus these patients usually die immediately after birth. And those that survive will still suffer from hypertension as well as portal hypertension from hepatic fibrosis. And then the final condition that we have here is medullary cystic kidney disease, which is more commonly seen in elderly patients. And these patients present with renal cysts in medullary collecting ducts, as the name implies, which causes loss of the concentrating ability of the urine in the kidneys. And thus again, these patients present with polyuria and polydipsia. And then you should also be aware that on the ultrasound, these patients present with shrunken kidneys. And that concludes our discussion.